Hello and welcome, folks. Thank you so much for being here. Good to see some familiar faces and some new faces. Thank you so much for being here and for being on time. Good to see you again too, Paulette. Thank you. And I see that people have already started to put their names in the chat. So feel free to type your full name and where you're from in the chat. You'll be ahead of the logistical curve. And I will say this a couple of times, if you're sharing your computer with anybody, if Opal happens to have somebody sitting off camera to the side who's also participating in the learning community conversation, please type their names in too and where they're from. We want to make sure everybody that's here, all 43 of you currently, will get credit for your 2 hours of participation. So thank you so much for that. Very glad that you're here. We're going to give it just a few more moments, and I want to assure you we will conclude promptly on time so that you can go on to your next appointment. My hope, too, is that I'll be able to leave you a little bit of time at the end. Sometimes I'm more successful at this than others, but that I can leave you a little bit of time at the end to complete the evaluation, the brief evaluation. So, folks, I can't thank you enough for being here. There are 60 of us in the learning community presently. I daren't, if that's even a word, wait any longer for us to dive into this content. Randy's considering, like, is that a word? I'm not really sure. Randy's like, no, definitely not. It's not a word. But I think you know what I mean. So, for those of you whom I've had the honor and the privilege to be in a learning community with before, welcome back. Really wonderful to be in the learning community with you again. And before I welcome the people who may be new to our learning community, I want to give credit where credit is due. And I do want to acknowledge, as I was saying to Carrie a moment ago, this is a new learning community course, new learning community conversation, and it is one that was inspired by the learning community. So I do want to give credit where credit is due. This particular strategy of ask, offer, ask has come up in several of our conversations. And I thought, because it keeps coming up, maybe I should develop a course that specifically focuses on this particular strategy. So thank you to the learning community for your inspiration to do that. And it's, as I was saying to Carrie, it's the first time we're doing this, so hopefully it will be of use and it will support you in what you're doing. Because honestly, folks, that is the purpose of every learning community conversation we develop and deliver, is to actually support you in a relevant way in terms of what you're doing. For those of you who are here for the first time, welcome. Thank you for joining the learning community and for being part of this learning community conversation about this particular strategy of engagement and conversation. I will also make one very intentional disclaimer at the very beginning. This strategy that we're going to focus on and discuss, and hopefully maybe even get a chance to practice, is not the practice of motivational interviewing. It is not the practice of MI, and to further complicate things, it is absolutely MI consistent and MI spirited. And it is not the practice of motivational interviewing. So this strategy can be applied in conversations that are conversations of sharing information, offering feedback, and other situations. And we're going to walk through that specifically. Welcome, Charles. So, folks, before we dive more directly into the content, I just want to take care of a couple of logistical details. I'll just say by way of very brief introduction, for those of you whom I've not had the opportunity to meet before, and please forgive me, those of you who we've been in learning community, you could do my introduction for me, probably. I am currently a research project director at the New York State Psychiatric Institute. My name is Paul Warren. My pronouns are he and they. And I am very fortunate to be a senior staff trainer and curriculum writer for the Northeast and Caribbean Addiction Technology Transfer Center. And that does mean that there are times when I'm forced to go to Puerto Rico, St. Thomas, or St. Croix to train. It's been a long time, though. I haven't been forced in a very long time to go there. But as Carrie and I were talking, I was just recently, yes, I know, Randy. I know. Thank you for the love. I don't, maybe that wasn't really love, but it is very awful for me, Charles. But it's my job, so I do it when I have to. Um, I did just recently, as Carrie and I were talking about, I did just recently return from New Zealand, where I had the great opportunity to attend the Mint Motivational Interviewing Network of Trainers Forum, which was an extraordinary experience. And I feel very honored that I was invited to present there and that I got to go. And many thanks to my colleagues and my supervisor, Dr. Mike Chappell, for making it possible for me to actually attend that conference. I'm also a social worker by training. I'm a graduate of Hunter College School of Social Work in New York City. And my area of emphasis while I was training as a social worker was group development and facilitation. I began my social service career in 1991, providing direct care to people living with HIV and AIDS. And I did that for a little over 12 years and then made the transition into predominantly workforce development. Okay. So very, very happy to have the opportunity to be in the learning community, focusing on this particular strategy of engagement and strategy of conversation, ask, offer, ask. And as I said a moment ago, and I'll repeat it, it is not the practice of motivational interviewing, and it can be found in Miller and Rolnick's fourth edition of their book, Motivational Interviewing, Helping People Change and Grow. The strategy itself is not motivational interviewing, but it is person-centered, client-centered, and am I consistent? It is not the practice of motivational interviewing, though. And there are a number of people in this learning community whom I've had the great opportunity to be in learning communities focused on the evidence-based practice of motivational interviewing. If that's something you're interested in, by all means, join us in future learning community conversations about motivational interviewing. And please do feel free to join those learning community conversations. I'm going to share my screen. We'll take care of a couple of logistics, and then we'll dive right in. So I'm just going to ask you to confirm in the chat by typing the letter Y that you can actually see my screen and see me at the same time. Okay. Looks like people can. Oh, fantastic. Very, very good. Very, very good. Excellent. All right. So again, welcome to Ask, Offer, Ask, a way of offering information and feedback that builds rapport. And I want to throw out another word here, and it will not be a surprise that I'm throwing this word out to many of you, a way of offering information and feedback that also supports engagement. So we can use rapport and engagement interchangeably here. There are now 74 of us in this particular learning community conversation. It is possible that a couple of other people may join us at some point during the conversation. What I would ask, though, while the 74 of us are in this learning community, that we be aware of and intentional about the words we use, because words do have power, and we can choose to use words that are respectful, welcoming, and inclusive of all 74 of us that are in this particular learning community. So if we can, let's use language that puts everyone in this learning community first, offers welcome and respect to everybody here. Because this is a learning community conversation, what you bring to the table, what I bring to the table, may not necessarily represent the official position of our funder, and that's okay, because this conversation is meant to actually support and be relevant to you, that this is something that you can actually use, in addition to getting the 2 hours of credit that you'll get for attending the full conversation. PowerPoint, I love to say this, PowerPoint makes it official. Welcome, exclamation point. And if you haven't yet done so, please type your full name and where you are from in the chat. If you're sharing your computer with anybody, type their full names and where they're from in the chat. This is a way we have a timestamp of that you are here and that you deserve credit for participating in this learning community conversation. As I mentioned, there will be a brief evaluation at the end. I am going to do my best. It's a new course. I'm kind of finding my way. I'll do my best to leave a little bit of time at the end so that you can complete the evaluation and go on to your next appointment. Please complete that evaluation. Once we receive it, we will send you a copy of these slides that you are free to use and share in any way that is beneficial to you, your organization, or your colleagues. You're free to share them, and we will also send you your certificate of credit. Okay, wonderful. It looks like a couple of other people have put their names in the chat. Excellent, excellent, excellent. All right. So just a couple of additional guidelines in regard to our being intentional about the language we use. You may or may not recall this, but when you registered for this course, you actually agreed to have a working camera and a working microphone. I know that stuff happens, and it's possible that you may be experiencing some sort of technical problem. That's okay. Just send me a private message. Let me know that. If you can turn your camera on, please be on camera. And please, if you can, be on camera for the entire time. Now, if you need to step away, that's perfectly okay. Just send me a private message and say, I'll be right back. I'm stepping away. Stepping out is different than stepping away. It's only a 2-hour learning community conversation, and really it's probably like an hour and a half of content. So please be present and participate for the full time together, because we want to be able to give you your certificate in good conscience. What I would ask, though, is that if you wouldn't remaining muted unless you have something to say. So if Tracy has something that she wants to say, she's more than welcome to unmute and just say, hey, I'd like to add this. I'd like to share this information. And that goes for everybody. And you can interrupt me. I don't mind being interrupted at all. So don't hesitate to unmute if there's something you want to add, a question you want to ask, a comment you want to make. Do not hesitate to do that. I would ask, though, if Tracy or anybody else in the learning community has the floor and they're making their point from the Golden Gate Bridge, please do not interrupt them. You can interrupt me, but please don't interrupt anybody else in the learning community. Let them make their point, and I'll do my best to offer you the space to make whatever point you want to make. What I would also add is that because we're a learning community, because there are 78 of us now in the learning community, we don't all have to agree. We also don't all have to be on the same page. What I would simply ask is if you hear something that you don't agree with, you give that person the respect of listening to what they're saying. And if you want to offer a different perspective, additional information, a particular reaction, you're more than welcome to do that because that's what we can do in a professional and respectful learning community. We don't have to all be on the same page. We don't have to all agree, and we can choose to listen to each other and offer each other mutual respect. The other and final guideline that I would simply ask that everybody consider at this particular point is making I statements. Now, sometimes in my role as the facilitator and guide of the learning community conversation, I may make a generalization. And I will try to do my best to preface with, I'm about to make a generalization, but I will also do my best to make I statements as well. So I'm going to stop sharing my screen for just a moment. Uh, Anita, that's perfectly okay. Thanks for letting me know, and not a problem. So I'm going to stop sharing my screen for just a moment so I can see all of your faces. And before I put my checking account number in the chat, I just want to ask, can everybody agree to those particular guidelines? You can wave, nod, throw money, deposit directly in my checking account, whatever works best for you. Excellent. Good. Okay. So those are our agreements as we go forward. Excellent. I love that electronic thumbs. Oh, look at Opal. She's got a many thumbs. Opal, I'm going to guess that you have a Mac, don't you? Do you have a Mac computer? No, it's a PC. Okay. Well, oh, and look at that. Isaac put flying money into the chat. Wonderful. Hello, Chantal. Thanks for saying hi. All right. So, folks, those are our guidelines. That is what we've agreed to. Thanks. Excellent. Karen has also put her name in the chat too. That's great. All right. So I'm going to go back to the screen for just one moment. And let us touch on, and I'm going to share the slide so that you can see this and read it yourself. But I wanted to spend a moment just discussing the goal of this particular learning community conversation. And I do have to acknowledge something here, and I'm going to actually use the chat to do a quick poll. Oh, yes, of course. If you're a member of the learning community and you happen to be riding on a bus and you don't want to turn your camera on, that's perfectly okay. I'm just making a general statement there. Excellent. Uh-huh. Understood, Chantal. And stay on. I'd rather have you on and unfortunately not be able to see you than have you get kicked off repeatedly because of bandwidth. So by all means, and thanks for sending me messages, folks, and letting me know your circumstances. Greatly appreciate it. Now, I know you've probably had a moment to read this particular slide at least once or twice. I want to acknowledge something here. And as I acknowledge this, I'm also going to ask you to answer this poll question in the chat, which is, I want to acknowledge that some of you may already be very familiar and using the ask, offer, ask strategy in your conversations. So if you are familiar and using ask, offer, ask already, type F in the chat. If it is new to you, type the letter N in the chat. So, and wow, 32 people have responded. Okay. So I'm somewhat familiar and for a lot of people, it's new. Okay. So I want to acknowledge for those of you who are somewhat familiar, fairly new. Okay. Okay. So it's new. Okay. Excellent. So I want to acknowledge for those of you who are familiar with it, that on some level, this is going to be a review and hopefully a revisiting and maybe, I mean, and again, I don't know, but maybe a refinement of what you're doing. So I just want to acknowledge that for those of you who are familiar, and for those of you who are, this is new. Oh, Helen, familiar. Okay, Joyce, new. Okay. So I just want to acknowledge that for those of you who are new to this, my hope is that not only will it support people who are familiar with it, my hope is that it will provide a clear roadmap and guide for people who it's new to and who want to incorporate it into what they're doing and will find it useful in terms of what they're doing. So again, it's an opportunity to specifically focus and possibly practice, given our time, possibly practice an intentional use of a particular way of interacting and communicating that's intentionally person-centered. And in our role as helpers, it gives us what I'm suggesting is a more effective way of offering information and or feedback during our conversations. Okay? So I'm throwing out to you the idea that the ask, offer, ask strategy can actually be a more effective way of offering information or feedback. And before we go to the learning objectives, I'm going to just stop sharing my screen for a minute because not a problem, Jennifer. Thank you for letting me know. Glad you're here. I'm going to stop sharing my screen for a minute because I want to ask anybody who is familiar with Ask, Offer, Ask what your thoughts are about my statement that it potentially is a more effective way of offering feedback and information. So anybody who said that they were familiar, and don't make me go back to the chat to figure out who was familiar, but anybody who said they were familiar, that almost sounded like, don't make me come back there. But anybody who's familiar with Ask, Offer, Ask, what are your thoughts about yeah, go ahead, Carrie. What do you think?
Yeah, I actually did see like the one of the what Susan was saying in the chat. Yeah, it does give the client a choice, and also another. I also want to add on to that, also saying that instead of it being, it also like kind of like it reinforces the overall like dynamics of the overall interaction. Instead of it being like you're higher up than the client, is also it's actually reinforcing the fact that it's more of a collaboration compared to a suggestive type of situation.
Thank you so much, Carrie. So the fact that it can create more of a collaboration, Paulette is acknowledging also in the chat that it gives the opportunity for permission. The client can grant you permission. And as Susan put in the chat, it gives the client a choice. And that's something, all three of those things, collaboration, we're going to come right to you, Lindsay, collaboration, choice, permission. Lindsay, the floor is yours.
Yeah, say it also give the person a chance to respond to what you said and have them think about it.
Yeah. So Lindsay, tell me if you're okay with me putting it this way too. It creates a space for reflection. The thinking about it. The person gets to reflect on what's going on in the car. Are you okay with that?
And checks for understanding, right? Because maybe they misinterpreted what you said or something. Or maybe
Yeah,
you
yeah,
misinterpreted what they said.
yeah. And it's funny, Lindsay, because I would link what you just said, that checking for understanding. I would link that back to what Carrie said in terms of that promotes collaboration. Because if I'm really trying to understand what you say and we're engaging in a dialogue about that, we're collaborating and it changes the power level. It does this. Is that fair, Carrie? Is that a good visual that it does more of this? Okay. Susan also adds it evens out the power dynamic. Yep, more to this than opposed to this, which is the client kind of and us looking down. It's more like this. I feel like I'm voguing, kind of. Excellent. All right. So the power dynamic there. Absolutely. Anybody else who's familiar with Ask Offer Ask want to say anything more about my statement that it's a more effective way of sharing information or sharing feedback? Okay. Feel free to unmute. Feel free to comment if there's more you want to add. Also, people are making excellent use of the chat. So I'm going to share my screen again, and let's take a look at what I hope, which may be ambitious, but it wouldn't be the first time I've over learning objected a learning community conversation. It may be too ambitious, all these different objectives, but oh well, what the heck? I'm learning too. So hopefully we will explore the role of information and feedback while providing services and care. State the rationale for asking permission. Thank you, Paulette. You put permission on the map before we actually even acknowledged it in the learning objectives. And it's really critical that it's there. And also, considering what the benefits might actually be of inviting a client, a participant, a consumer to share what they know or think about something before we actually share what we know or think about something, and prioritizing them first. And I'm thinking of Carrie as I say that. I'm thinking of this, Carrie, that collaboration. I'm not voguing, I'm thinking about power. Also, we're hopefully going to have some demonstration here. Again, time permitting, we'll have some demonstration, and asking permission is part of the demonstration. And also, and I can't remember who it was who alluded, I think it was Lindsay, and Lindsay, tell me if I have this right, but did you not say about helping them and asking them what they think about what you shared? You didn't quite say it that way, but I think you alluded to that. Am I remembering that correctly from just a moment ago?
Yes.
Okay. All right. So there is a rationale for that. It's not just because I read it somewhere. There's actually an impact. And then the other piece, and I want to link this back to what Susan said and what Carrie said about power and choice, that we need to be considering the role of autonomy during the ask, offer, ask conversation. Okay? So by way of introduction / polling the learning community, I want to propose two things. The first one is I'm going to ask you to use the chat, and the second bullet we will I will bring the slide down and we'll have a conversation about this. But what I'm going to ask everybody to do is use the chat in the work that and there are 80 people in our learning community. So we have the opportunity to hear from 80 people working in a variety of settings, in a variety of places. So if you think about the overall percentage of the frequency that you share information with participants, patients, consumers, what is the percentage? How frequently are you sharing information as part of your job? And just type that percentage. It can be from 0% to 100%. What percentage are you sharing information as part of your work? So I'm getting some 90, some 10, some 80, some 70, some 45, 80 to 70, 75, 90, 77, 80, 100, Daniel says. Dominic says 100, really about 40, 80, 85. Okay, so it seems that the percentages are fairly high. Some people, it's less than 50%. But for some people, and Kirsten just writes 80+%. Okay, so the percentage is fairly high. Now, keeping that in mind, it is and I guess the reason, well, let me take down the screen for a minute. I want to pose this question before we go to the second bullet. What do you make of the fact that for at least the 80 people in our learning community, the percentage of sharing information is a significant component of the work? What do you make of that? What thoughts or reactions do you have at the idea that, giving or offering information, sharing information? Yeah, Amber writes, it is very significant, quote. So many of us are educators, Jennifer says. Yes. Yes. And Anita writes that we have a lot of knowledge and power in the potential. Ooh, hold on a second. That just, we have a lot of knowledge and power in the potential of how we influence those we work with. Absolutely. And, and Caroline writes, we work with clients, and working with clients involves sharing information. Isaac writes, making yourself vulnerable may allow others to be vulnerable with you in discussion. Very true. Paulette adds, and indirect services or client service role, we need information to provide services, truly. Alicia writes, it is a way to show us present and that present and that, okay. It is a way to show us present and that we care. You care about the people. Absolutely. I got it. It challenges us to be effective communicators. I don't want to talk at people. I love participation and feedback. Lindsay writes 30 or 40%, even though I know it's supposed to be 20, i.e. 80-20 rule of 80% listening, 20% talking. It makes a lot of sense. Psychoeducation plays a huge part in direct services. Okay. Susan adds, in the peer role, we are resource brokers. It's all in how we share the information. And Susan, you're also alluding to the how, the way the information is shared. Anna writes, my clients depend on me to know more than outside the scope of my work. Yeah, so oftentimes you're being relied on for information that's not even necessarily within the frame of your work. Okay, so I'm going to share the screen again just because I really worked hard to get the animation on this particular slide, and I'm going to reveal a word. Tracy is delighted that I'm using PowerPoint so effectively. I'm going to reveal this word through the magic of PowerPoint, and I'm going to ask you, and then we're going to unmute, and I'm going to take the slide down, but I'm going to ask people if a few of you will unmute and share your reactions to this word. So don't judge your reaction, just note it when I reveal it through the magic of PowerPoint. Just acknowledge your reaction, and then I'm going to stop sharing the slide and invite you to share your first thought, the first thing you think of when you hear the word. Here it is. Tracy, drum roll, please. Excellent. Permission. The first thing you think of when you hear the word permission. And I'm going to ask some folks to unmute.
Allowed.
Allowed. Okay. Other folks. Any other folks? Let's hear your voices in regard. Go ahead, Paulette. What do you think of?
It says stop. I think stop. Yep.
Stop.
Permission,
Okay.
stop. You can't just move without stopping.
Got it. Got it. Go ahead, Randy.
I didn't have a thought. I had more of a body experience. I felt relaxed. I felt a sense of relaxation and ease.
Yeah. Relax and ease. Thank you. And if we can, let's hear the voice from two other people. If you would be willing to unmute, what's the first thing you thought of when you heard the word permission? And go ahead, Tracy.
Vulnerability.
Who said that? Who said Carrie? Okay. Vulnerability. Go ahead, Tracy.
I think respect, just respect.
Respect.
Mhm.
Respect. And go ahead.
Boundaries.
What was that?
Boundaries.
Boundaries. Okay. Excellent. And Susan, what do you think?
I kind of went the other way with it. Like, how do I not automatically have permission to speak as a client or a participant? You know,
Yeah.
why do I need you to give me permission? But that's just how I felt in the moment. Never thought of it that way before.
Fantastic. Yeah. 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 Thank you, Susan. And we have tons of things in the chat as well. Power dynamic that requires, needs permission. Yeah. And you know, Susan, such an interesting perspective. And I will throw out, as you were saying that, it also made me think the permission that we're really asking for is for us to speak. It's not really we're asking permission for them. It's we're really more asking permission for ourselves. Jennifer writes in the chat, permission that what you have to say might not be the same as the person offering the permission. Jennifer, I'm not sure if I understand that. Can you, I don't know if you can unmute. I'm hoping you
I
can.
can, yeah.
Yeah, can you say a
So-
little more about that?
Sure. So when you offer somebody permission, you are willing to hear that it will be different from what you thought they should say or what you thought the rules would be, that you are open to something different and all with safety around it than what you thought.
Thank you. And you know, Jennifer, if it's okay, I want to add a word to what you said and tell me
Sure.
if it contributes to what you said, or if
Okay.
I've gone off in a different direction.
Have at it.
That somehow permission also is a kind of acceptance.
Correct.
So that I was connected to what you were saying.
I'll give it to you, Paul. Yeah.
Okay. All right. And I have to admit, I really appreciate you adding that, because it had never occurred to me that when you ask permission, you are basically creating a space where you're saying, whatever you want to offer me, I'm going to accept it.
I'm going to hear it, right?
I'm going to hear it. Yeah. I'm going to consider it.
Mhm.
Fantastic. Thank you so much, Jennifer. Yeah. And Alicia writes, we have the power to choose. And you know, it's funny, Carrie, you mentioned choice very early on. And we keep coming back to this idea of choice. So I'm glad we keep coming back to this idea. Agree, stuck or stopped from being allowed to do the things that may be needed to share by the dynamic of the team. Lee, can you say a little bit more about that? I'm not exactly sure how that relates to the worker participant client dynamic. Can you say a little more about that? Or are you like broadening it out even to the larger like collaborative team? If you're able to unmute. I don't know if you yeah, go ahead, Lee.
No, I
Good to
work
see you, by the way.
Good to see you. I've missed classes a lot lately because of being busy. I work in a living room setting, so my job is a peer-to-peer. As a peer-to-peer, we have limitations that we are a little bit, the fact that we can share more of our story than a regular clinician can possibly do. But we also get, depending on the people that you work with in the area that you work, will kind of be determined whether you can, how far open you can be. And I have a tendency to like for asking permission if it's okay to share and if they want to hear my story. So sometimes asking permission can be a blockage because they don't want to hear your intake on it. And as well as others that I work with feel that sharing anything can be overbearing and too much, even though it's my sharing my story and allowing others to hear my story that gives them the opportunity to see, I know where they're coming from. I see it. I've been through it. But when you're stopped from sharing the way you feel is best for that client.
Yeah.
And you're just allowed to keep it monochrome and not really give them the chance to ask questions.
Yep.
It does kind of flip us backwards.
Thank you so much for elaborating on that. And I think I have a better understanding of it. And there are two things I really want to underline in what you said. And I'd be very curious as to your reactions to these two things. One, and I think this is an important consideration, and I want to link this to choice, and I also want to link it to power, is that when we ask permission, and Lee, you gave a great example. You're a person with lived experience working in a particular setting where your story is intended to be part of the work. When we ask permission, we do run the risk of the person making the choice that they don't want to hear what we have to offer. And that can be an outcome. And that's the person exercising their right to choose. And I think it's important to acknowledge that. And Lee, I have a slide that says this, but I'll say it now because you prompt me to want to say it, which is that when we ask permission, I think it's important that we need to be prepared to honor the person's response. So if I ask Randy permission and Randy says, yeah, go ahead, share that information, or yeah, go ahead and share your story, I'm prepared to do that. And if I ask permission and Randy says, no, I'm good, I have to be prepared for that. So I think we have to look at the whole thing, which is the takeaway here is if we're going to ask permission, we have to be prepared to accept the person's answer. Because I don't know about you, I don't know if you've ever been asked permission this way, but where the person will say, so, Susan, can I tell you a little bit about this? And before Susan can say, yes, no, I need a moment to think about it, I've already started telling her what I wanted to tell her. So the takeaway here is if you're going to ask permission, let the person answer and be prepared to respect their answer. Yeah. There is a difference between a person declining comments and your employer telling you that you shouldn't share your story. Yeah, that is a different thing. And again, I think the other thing that I would throw out here for consideration is that organizations and programs have parameters or guidelines about self-disclosure. And self-disclosure is a form of information. And also, Lee, I'm sure you're not alone. There are probably other people in the learning community of the 81 of us that also may have lived experience, and they may be hired in the role of a peer counselor or a peer educator. And of course, one always has to determine, is the offering of my lived experience appropriate to this moment, and is it in service of this client's health or life goals? So it is absolutely relevant to this strategy of ask, offer, ask. So Lee, any thoughts or any reactions to any of what I underlined in terms of what you said that you would comment on?
I mean, yeah, I have two clients in particular that I'm thinking of. They have asked repeatedly every time I meet with them, please do not share this with anybody else you work with. And I have to do as they request, even though it makes my boss really mad because she wants to know what's going on. And I'm like, I'm sorry, they don't want me to tell anybody else about it. And I'm like, but if it gets to a point where I'm nervous about it, then you will be brought in. I also have another one that is similar, but she doesn't like one of the other staff members.
Yep.
So I can report it to my boss, but I can't put it in what we do a shift note at the end of our shift. I can't put it in there. I can say she came in, she did group and what she ate while she was there, but I
None
cannot
of the
put what we
details.
talked about.
Yep. And again, you're also talking about confidentiality, and we know within programs, confidentiality has limits. If a person is going to harm themselves or harm somebody else, if they're harming children or neglecting children or harming or neglecting older people, there are limits. So yeah, it is a tricky navigation, and especially of sharing other people's information. And Brittany writes, self-disclosure can be beneficial, but also boundaries should be placed around it, of course, like being aware of what you are sharing, how it could be used or against you, for or against you. I think it's good sometimes to share some details, maybe show you can relate, but there are private details that also shouldn't be shared, of course. Yeah, Lindsay, go ahead. The floor is yours.
I just wanted to kind of challenge that belief of like, if somebody's going to, so in some states such as Texas, right, we
Yeah.
are, peers are not, we are mandated reporters, so we do have to say if somebody is abusing a child or an elderly or
Absolutely.
right, but we are not, we don't have the duty to warn, which is when somebody's going to tell you they're going to hurt themselves, that
Yeah.
you have to tell somebody else. So Texas doesn't have that.
Yeah.
So peers, we shouldn't be. If they don't want us to disclose that they're going to hurt themselves, we shouldn't be in Texas.
Yeah, thank you. And Lindsay is absolutely correct that every state has their own sort of regulations or guidelines about this. And depending on your role, if I was a social worker in Texas, being a social worker in Texas and being a member of the NASW, the National Association of Social Workers, I would have a different set of ethical guidelines that I would be following, regardless of what the law, quote unquote, in Texas might be. So there can be sort of challenges, or one has to follow the ethical guidelines and the parameters that are set up within your profession, as well as your program, your organization, and your state sort of laws. And Lindsay is also noting the idea of dual relationships, that, and especially in rural communities, that can be a very unique challenge. And again, all of this inspired by the word permission. The fact that in the role that we're in, we ask permission. We can ask permission. We can choose to ask permission. And before I show you the next slide, I want to just tell you a very brief, funny story. And only funny because it's sort of charming in the sense that I worked with an organization in New York City with a group of folks who were focusing on refining their practice of motivational interviewing. And asking permission is very, am I consistent? And one of the practitioners said, I never ask permission. If they're in my office and we're meeting, I just ask all the questions that I need to ask. And, we talked about that. We talked about her relationship to asking permission, why asking permission felt so uncomfortable and inaccurate for her. And she was like, I just don't think I'm ever going to be able to ask permission. And, I got to work with her and her group, her colleagues, for 6 months. And it was hilarious because one day she came into the group, sort of, the group supervision that we were doing. And she was like, I have to let everybody know that I asked permission. And the client said yes. They gave me permission. And it was fascinating because she felt so strongly about it. And then she kind of tried it out and she tested the waters. And so keeping in mind, folks, that asking permission has to have authenticity attached to it. And again, I want to go back to what Lee said, because I really appreciate you putting this on the table, Lee. We need to be able to accept the person's answer to the offer, to the ask. I'm going to share my screen again. So just to be very clear, so that we're all on the same page, I made this statement at the beginning of our learning community conversation, and I will repeat it here. The strategy of ask, offer, ask, although it appears in Miller and Rolnick's 4th edition, their MI book, this particular strategy is not the practice of motivational interviewing. It is an MI consistent approach, an MI consistent strategy, but it's a way of engaging in conversation with patients, clients, or consumers that allows us in the role of the helper, and I'm thinking of Carrie as I say this, to collaboratively contribute as opposed to hierarchically contribute. Collaboratively, discussionally, if that's a word, contribute while continuing to engage the person and to respect and support their autonomy, the autonomy of the patient, the client, and the consumer. So to be very clear, this is a strategy of conversation that we can employ to engage the person and to respect their autonomy. Okay? And it does create an opportunity for us to be, and I'm going to say it this way, and hopefully you'll be okay with this, to be an authentic collaborator as opposed to a posing collaborator. Okay? So just keeping that in mind, just to be very clear that that's what it is. Susan adds in the chat, ethical and helpful self-disclosure can be a whole training in and of itself. It certainly can, Susan, and it's funny that you'd say that, because I'm actually in the process of developing a learning community conversation that's going to be about sharing lived experience and also maintaining appropriate boundaries. So stay tuned, more to be revealed in regard to that. I do want to make sure, though, that we're being very clear about what ask, offer, ask is. So I'm wondering, though, what are your thoughts about why we would choose to employ this ask, offer, ask strategy? Yeah, go ahead, Caroline. Go ahead.
I put it in the comments, but I was thinking it kind of makes the statement less confrontational. So if whatever you were talking about and you have some sort of insight that you might want to say, if you just said it, it may come across a little confrontational or a little harder for the client to receive. But if you're asking, would it be okay for me to give you some feedback? Then the client is already kind of preparing themselves. Okay, I'm going to get some sort of feedback. They're making the choice whether or not they want to hear it. So they're kind of saying like, okay, like, yes, I can have the feedback and I'm okay with this. And now I have some power in it. So they're preparing themselves to hear whatever you have to say. So I think it makes it a little less confrontational and maybe more easily digestible for the client.
Okay, so a rationale that you're throwing out there, that you're offering, is not only can it decrease confrontation, it can also help somebody to hear something that might be more difficult for them to hear. Okay, fantastic. Thank you. And again, thank you for focusing specifically on the application of it for offering feedback. So what about in other situations, folks, where maybe we're just offering information, we're sharing information, we're not, and feedback is information, but it's a different kind of information. But let's say we were just offering information. What are your thoughts about what could be some of the benefit of employing this strategy? I see a couple. Tiffany wrote in the chat, also to understand your client. Absolutely. Antonia writes, the client feels respected and valued as an autonomous being. Even for clarification, Susan also adds, it helps if you have currency in your relationship wallet. Asking permission puts more currency in your wallet. Yeah, absolutely. And other thoughts about why we might want to employ this strategy? What do you see as the benefits of employing the strategy, in addition to what Caroline said? Paulette writes, trying to be sure that the client is ready for the feedback. Yeah, because they might not be, and they might say, I'm going to pass on that right now. And I will also underline that the strategy has a part that would come before asking if you can offer the feedback. And it also has a part that would follow after, if we're talking about the feedback piece. Building the trusting relationship. True, it can do that. That can be one of the benefits. I guess this is where the other ask comes in. What do you think about what I've said? Yes. So Caroline offers the feedback and then says, Paul, I'm wondering, given the feedback that I offered you, what are your thoughts about that? What's your reaction to that? Yeah, absolutely. Yeah, ask to make sure you aren't pushing information on the person they may not want. Absolutely. And Susan also adds, gives choice. Sometimes they haven't had a lot of choice. Yes, sometimes they haven't had a lot of choice. And I'm going to throw this out. And again, tell me if you think I've gone too far or I'm not speaking to the experience of your client. I think maybe I am, but tell me if I'm not. Not only have they not had a lot of choice, they may have had a lot of trauma. I see some heads nodding. So I'm not off base in regard to that. And this strategy is also okay. So Tiffany says yes. Okay. Thanks, Tiffany. I did see some other heads nodding too. So this strategy can be very helpful in not re-traumatizing somebody as well. Yeah. Paulette, you agree with that, it seems.
Might I add, Paul, that it's a way of prioritizing the client as well, because they're triggers. We could say, may I say X or may I share something with you? And then they may say yes unknowingly. And then before you know it, we're in a trigger situation.
Yes. Yes. Absolutely. Yeah. Go ahead, Myra. The floor is yours. Go ahead.
I just want to say that when I hear permission, I feel safe. So probably if people have trauma, they will feel safe too.
Yes. And Myra, thank you for adding that. And it made me think of what you said earlier, because I think you said you felt relief. Am I remembering that correctly? You did. I am. Okay, good. All right. Excellent. So I'm going to share my screen again, and I'll just reiterate in terms of some of what was said, considering that, why we choose this strategy. Well, it promotes engagement, rapport, and it can build trust. That it can be the outcome of it. It also, and I think this is particularly important from a cultural humility perspective, it's also a way to share power. And again, Carrie gave us that idea of that collaboration. We've moved from this to this, and that's power sharing, and that's intentional. It also fosters partnership and collaboration. And it is client/person centered. It's prioritizing that person. It's giving them the opportunity to exercise their autonomy. And somebody else mentioned this, and I'm glad I have it on the slide. It respects the patient, the client, or the consumer's autonomy as well. And I see Firouz writes in the chat, sometimes clients are highly educated and he may already be aware of the information. Then I can change the strategy of discussion. Absolutely. And I really appreciate that you said that, because I do want to underline something here. And I'm just throwing this out for consideration because I couldn't agree more with what was written in the chat. And you only sent that to me, by the way. I don't know if you intended to send it to just me, but you only sent it to me, and I hope you don't mind that I read it out loud, but I couldn't agree with that statement more. Patients, clients, participants come to the moment with us with a lot of information and a lot of experience. And we want to employ their understanding, their information, their experience. We don't want to assume that they know nothing. Okay? So that is an absolutely critical point that I invite you to please, please, please take away from this conversation. Acknowledging the fact that if I have the opportunity to sit across from Paulette, and trust me, that would be a great opportunity. If I have the opportunity to sit across from Paulette, Paulette is going to come to the moment with a whole life of experience, with a whole life of knowledge and understanding. And why not tap that before I open my big mouth? Because Paulette will probably have a lot to bring to the table. So just keeping that in mind is a central tenet of this strategy, the ask, offer, ask strategy. I'm going to share my screen again. So I'm hopeful that you're looking at this word, okay? That you can see this word. Anika, you can see it? Yeah? Okay, very good, very good. So what I'm going to ask everybody to do is, as you see this word, what's the next word that pops into your head? Or what's your reaction word? And type it in the chat. When you see this word, what pops into your head? And I'm watching the chat: order, advanced, controlling, mandate, authority, instruction, order, movement, action, order, no choice, instruction, authority, medical, authority, manipulative, medical, guidance, goal, power and control, action. Okay. Yep. Superior. Yep. One way, action, direction. One thing I want you to consider in regard to this word is the fact that we want to be thinking about directional. Even with the strategy of ask, offer, ask, we're always thinking about directional versus directive. Now, somebody please unmute and tell me the difference between those two words as you understand it. The difference between directive versus directional. What does that mean to you? Is anyone willing? Yeah, go ahead, Caroline.
I was going to say directive sounds very much like a very specific, this is how you have to do it, versus directional is just more of a push in a certain way.
Okay.
And maybe less specific, a little bit more open to interpretation, more ability to sort of make it your own versus I have to do it one way.
Okay. So the field is a little wider.
Yeah.
Mhm.
More
Yeah.
customizable.
Customizable. Okay. Tanya, go ahead.
For me, yeah. So for me, directive is like I'm telling you what to do. I'm giving you a directive. I'm like a boss may give you a directive where to go. Directional is like, have you seen this role, this direction, this way that you may want to consider? Have you explored this other option, right? But I'm just giving you a way to see a new role, maybe that maybe you have experience or not, instead of giving you a directive.
Excellent, thank you. And if we can, let's hear from, yeah, go ahead, Jesse, please go ahead.
And I agree with what the last two people said, and then I'll add, like, for directional, like it gives me, like, in my mind's eye, like sharing of information, so it's like in both directions.
Yeah, and Jesse, you're even talking about bi-directional, that it's coming both ways. The information can be shared back and forth. Fantastic. Thank you. Thank you so much. Zena, go ahead. The floor is yours.
Good morning. Yeah, in the chat, I put the direction in there because to me, it's which way is the conversation going, the information, and it gives you room to go back and forth. And maybe this isn't working. So now you have the opportunity, maybe go this way. So it's all about movement and the flow of the conversation.
Thank you.
Being able to come back and double back on some things, maybe.
Yes, and that also speaks to what Jesse was saying about how the conversation can go back and forth as well. Because it's a conversation between two collaborators. It's not this. Yes, thank you so much. Thank you. So directive is do this, and directional. Oh, I'm hoping people are seeing what Susan wrote in the chat, because Susan, I may need to steal that for a slide. I like how direct it is. The idea of directive is do this, and it's me saying you do this, and directional is kind of like, what if? What about this direction? What about this information? What if we look in this direction? Yeah, excellent. So keep in mind that this strategy is a directional strategy, and it is guiding. Yes, Jennifer, that word is, and several people have said the idea that it's guiding. It is guiding. It's about guiding. Excellent. Welcome back, Tracy. Directive is that this is what you are to do. Directional is guidance. And a couple of people, and Jennifer, just reading what you wrote really makes me think of this too, is that directive puts me as the helper at the center. And directional is that maybe we're walking together in a particular direction, if that's the direction we decide to go in. But directive is I'm at the center and I'm kind of calling the shots. And I guess, I'm inspired by what we've been talking about to frame this question this way. I hadn't planned this, but I do want to ask it, which is, what's the downside of me as the helper being at the center calling the shots? Does anybody have an answer to that? Like, what's the downside of my being, as the provider, being at the center and saying, hey, Tracy, this is what you should be doing?
I think when you're at the center, you have to be mindful that you're trying to not take control. You want to give that person the opportunity to express themselves.
Yep. Okay. So really trying to decenter yourself, not being at the center. Yeah. And it's not person-centered. Absolutely, Paulette. And assumptions are being made. Kirsten said, you already have a script or a thought for the way it should go. Yeah, Brooke, go ahead. The floor is yours. What's your thought about that? What's the downside of me being at the center and calling the shots? Why shouldn't I be telling you what to do?
Well, the likelihood that they will just go along with whatever you're saying is high in the moment, but that they'll actually follow or even return is pretty low.
Yeah. Yes. Thank you so much, bro. Yeah. And Caroline writes, you may miss the mark. Absolutely, I may miss the mark because it's my mark, not their mark. And my goal is to help try and understand their mark. Yes, Elisa, go ahead.
Hi. Yeah, you are taking the chance for the other person to grow and reflect what they are learning and their own experience. So you are taking the reflective on you.
Yes. Yeah. Yeah. Which, as a number of people have said, is not very person-centered. It's worker-centered.
Yes.
Thank you. Thank you.
Thank you.
Thank you. Yeah. And Antoinette writes, they may also lose interest. Yeah. And Jennifer adds, I am taking away their choices in their own life. I'm going to repeat that. That is very powerful. And I couldn't agree with that more. I think that's so beautifully put. I am then taking away their choices in their own life. And you know what? Go ahead, Jennifer. Go ahead. Yeah, go ahead. Jennifer Brown, did you want to add something?
No, I'm sorry.
No problem. No problem. So I couldn't agree with that statement more. And I will also throw this out, and you could tell me I'm crazy, but I will throw this out. I don't believe most people, I'm making a generalization. Here's the generalization. I don't believe most people go into helping work because they want to take away people's choice to make their own choices in their work, their life. I don't believe that's just my understanding of having had the privilege of being in learning communities with people who are doing this work with you. I don't believe that's why you're doing this work. I don't believe you're trying to take people's choices away. Somebody please tell me if you think I'm wrong, but I don't believe, go ahead, Tracy. If you think I'm wrong, tell me. I don't believe that's why you're doing this work. In fact, I believe you're doing this work, generalization. I believe you're doing this work because you actually care. I believe you're doing this work because you don't want someone maybe to have the same experience you had. You want to help them achieve their life goals. You want to help them achieve their health goals. And honestly, this strategy, although very simple, can actually aid in that. And we won't, and I'm going to read what Jennifer wrote again because I think it's very powerful. If we are centering ourselves and we are calling the shots, I am then taking away their choices in their own lives. That's a quote. And we probably in our heart of hearts, generalization, actually, I'll make it an I statement. In my heart of heart, I do not want to do that to somebody that I have the privilege to be sitting across from, possibly helping them to move toward their life and health goals. I don't want to take away their choices. I'm going to share my screen again. So there is related, and this is so perfectly timed. I'm amazed that it worked out this way, but it's so perfectly timed with this idea of being directive, because there is a dynamic that I know that I'm definitely making an I statement here. Sometimes because I care, my fixing reflex switch gets flipped. And basically, the thing I'd like you to consider in regard to that, the fixing reflex is the desire to rescue, solve, educate the person out of making a bad choice. And some people call it the savior complex. I want to acknowledge that that is often a helper reaction. if we care, if we listen to the person across from us, because we're a helper, our fixing reflex switch can get flipped. I also want to acknowledge that that's normal. That's a normal experience for the helper. And what you can do is you can accept that you have it. I have made peace with the fact that when someone sits across from me and they're telling me I'm about to walk into this big hole, that there is a part of me that wants to pull them away from that hole. And I have to accept that there's a part of me that wants to do that. And I can acknowledge that I want to do that, but I don't act it out. Now, let me be very clear. If someone's at risk for harming themselves or harming somebody else, of course, I'm going to do first things first, because safety, keeping people safe when they're in imminent danger, is an ethical professional responsibility. My point being that I'm not going to try and convince somebody. I acknowledge that maybe I want to, but I'm going to resist acting it out. And what we can do is we can refocus ourselves being guided by this acronym rule. And the acronym basically says that resist acting out the desire to fix. Put your energies and your focus on trying to understand what the person is telling you and where they're coming from and where they're at this particular moment, and listen to them deeply on multiple levels, not just what you're hearing. And really put your energy into empowering that person, meaning that you're empowering them to exercise their autonomy. And I'm going to stop sharing my screen for a minute because I want to acknowledge something here. There are times, folks, when a person, a patient, a participant, a consumer, they exercise their autonomy. And I don't know if you've ever been in this situation, but I've been in it many times. This person will exercise their autonomy, and I don't like the choice they've made. I don't like it. It doesn't feel like the right choice. And I have to sit with that. I have to take that to supervision. I have to talk about that with trusted colleagues. And I do my best to try and accept that person's right to exercise their autonomy. I don't know if you've ever had this experience of where participants that you provide care to, they don't come back sometimes. I really don't like that choice. And it's not a choice that I have control over. What I have control over and how I interact is when I'm in the moment with that person. And that's why this particular strategy, I think, can be helpful in regard to that. I want to read, Isaac writes in the chat, it reminds me of the saying that sometimes someone doesn't want you to fix their problems, but rather they want you to hear them and validate their feelings. Absolutely. Sometimes you just want to be heard. You don't want to be told what you need to do. And Lindsay writes, I would challenge that assumption in the end. If a person wants to take their own life, that's their choice. You can sit with them and discuss it and make sure they fully understand the choice they are making. But at the end of the day, it's their choice. And you know, to Lindsay's point, I think you're absolutely right about that. And what I would also say, because I'm a licensed social worker, if somebody tells me that they're considering taking their own life, I, as a professional, as a licensed professional, have to take certain actions, whether I agree with their autonomy in regard to that or not. And that's what I've signed up for. That's what I was trained for. I am a mandated reporter. And there are actions that I would have to take. And I will acknowledge, to Lindsay's thoughtful and insightful reflection on this, and thanks for sharing that with us, Lindsay. I would also acknowledge that I would be ethically and professionally not respecting this person's autonomy. And that is what I am held to based on my license and my profession. But to call it what it is, Lindsay, you're absolutely right. That's exactly what it would be. Because ultimately that person, let's say, I take actions and they're hospitalized. Eventually they're going to get out of the hospital and they may not be in my care anymore. And ultimately those decisions, be they life and death decisions, be they treatment decisions, the person who ultimately makes them is the client. Yes. Tracy writes, I have been told by many psychiatrists, if a person says they are going to take their life, you are to call 911. Thanks for sharing that, Tracy. Susan adds, check out QPR or assist for more training on what to do in that situation. Thanks for the resource, Susan. Very helpful. Thank you. Thank you. I'm going to share my screen again. So we can be reminded about not acting out our fixing reflex, and to be very clear, ask, offer, ask is non-directive. It is directional. We are not telling people what to do very specifically, very intentionally, and we are helping that person to move in a particular direction, just so we're very clear about that. So, permission. A word or two about permission. We've discussed permission. And before I reveal the bullets that are on this slide, I just am wondering. And I'm not sure if during the course of our learning community conversation today, I have asked anybody if I could ask a follow-up question. I'm not sure if I've done that. Does anybody recall if I've done that or not? I don't think I have. No, Tiffany says no. So, and I also don't think I've asked anybody a question. I think people have just offered what they've offered. So I often will ask permission. I might say something like, Caroline might say something to the learning community, and Caroline, you've probably been on the end of this stick when I've said to you, Caroline, would it be okay if I asked you a follow-up question? So I'm wondering, folks, when I do that, when I've done that in a learning community. So Caroline, would it be okay if I asked you a question?
Sure, Paul.
So notice, thing number one, I waited for Caroline's response. Thing two, so my question is when I do that, what do you experience as my intention? And I'm asking you like what you experience. What do you experience as my intention?
Honestly, I feel like we probably know I'm going to say yes because, you're the facilitator. So there is a position of authority in that, right? Because you're teaching us. So like you're here and we're here. Probably from my own personal experience with like positions of authority, I'm kind of going to be like, yes, like I'm not going to say no to authority, most likely, unless it was something that I really, really felt uncomfortable about. Yeah. But you asking me a question or a follow-up question, especially because that means I've already offered something. Yeah. So I kind of feel like you expect me to say yes. You're hoping I say yes. So I'm just going to say yes.
Okay. Could I ask you one other follow-up question?
Absolutely.
If you didn't want to say yes, do you think you could tell me that?
Probably, because again, usually what in this context, I don't think you're asking me anything that would make me super uncomfortable. So I don't think that there would be a situation in these type of trainings that I've already shared something that you're then asking me a follow-up that I would be like, absolutely not. In other contexts, maybe, but I don't think in this context I would. Also, I've taken many of your trainings, so I feel like a level of comfort with you at this point. So, and I know that you're not going to like try to embarrass me or something like that. So I know there's a safety bit. So
yep,
I would be okay.
So to some degree, you trust my intention.
Mhm.
I'm often building on what you've offered already, so I'm really inviting you to elaborate. And you know that my intention is not mean-spirited. I'm not going to try and humiliate you or make you uncomfortable in our professional learning community setting.
Right. So I think it would be highly unlikely for me to feel uncomfortable to the point where I would want to say no. But if I actually felt that way, I would say no.
Thank you. Thank you so much. Thank you.
You're welcome.
So some people have put some things in the chat. People sometimes want to please. Kirsten writes in, and Annika writes, makes me feel like you are really connected to what I have to say, and people need to feel safe, Paulette adds. And Susan Carr writes, that's a slippery slope as far as the power differential. Depends on the relationship you have with the person and their level of trust. That is absolutely true. It is absolutely true. And I guess, Caroline and the comments that came in the chat prompt me to want to do a poll of everybody in the learning community at this particular moment. And I will throw out that you're free to respond to this poll or not as you see fit. I want you to exercise your autonomy. The question that I want to pose to everybody, and you're free to answer this question or not. If I were to ask you permission to ask you a question, would you feel comfortable if you didn't want to answer the question? Would you feel comfortable saying no? And I'm just inviting people to trust their gut. And Randy wrote, from you, yes. And Randy, I don't know if yes, I would. Honestly, honesty is the best policy, Amber says. Yeah. So, and Sabrina says no. Okay. Yeah. Depends on the question and who it's coming from. Well, Lizbeth, it's coming from me. So I let you determine how you'd answer that question. And again, we don't know what the question is. Point well taken. It does depend on the question. Caroline's point, which is really a powerful point to consider. The context within which the permission is asked. The setting. I mean, we're in a learning community, folks. There are 85 of us here. And some of us have been in a learning community together before, and some of us have not. Some of you I've had the great opportunity to be in a learning community with before, and others of you we're meeting for the first time. I guess the thing I'd really like you to consider in regard to permission, and I'm thinking of Paulette as I say this, and Paulette, I have to be honest and say I can't exactly underline why I'm connecting what I'm about to say with you, but it seems like the right connection is that permission is about authenticity. When you ask somebody permission, you are authentically asking. And I'm thinking of Lee as I say this, you are going to be able to accept whatever answer they give. That you're honestly asking and you're really open to whatever they say. And if they say no, there it is. If they say yes, there it is. If they pause and have to reflect on it for a while, there it is. Be with them in the pause. Go ahead, Paulette, please. Yeah.
Oh, I have a kind of a weird question or just situation. So
Yeah.
authentically, may I ask you a question? I've asked the permission and they have said yes or no, but then they go, okay, it's all right. And then they just say, I take it back. I don't want to give you that permission. Then what?
I'm so glad you had that weird situation because it's a real situation and people can revoke their permission, and that's okay too. And I can also tell you, Paulette, I've had the opposite of that, where I've asked and and I'm making an I statement here. People have said to me, no, you can't ask me a question. And I've accepted it, and they're stunned that I didn't push back, that I didn't try and get them to answer the question.
Correct.
And then they say, basically what they're saying, they don't say this in words, they say, okay, you passed the test, you can now ask me the question. And I think that comes out of because they feel that I'm respecting their answer. Thank you so much. Thanks. Lindsay, the floor is yours. Go ahead.
So depending on how well I know the person, how long I've been working with them, if they say no, I might try to find out why. Like, what is something making you uncomfortable, or or what I'll do if I don't know somebody is let them know my reaction to that, to be authentic, right?
Yeah, absolutely. And again, I think the point I really want to underline here in regard to this is that when you use permission, and PS folks, asking permission is part of ask, offer, ask. It really is. It's a baked in kind of ingredient to ask, offer, ask. So, if there's one thing that you consider doing after this learning community conversation, and I just throw this out for your consideration, is to reflect more on your relationship to asking permission. So, having said that, Ashley writes in the chat, is it okay to ask someone why they don't give permission to get a better understanding of what they are thinking, feeling? Ashley, really interesting question. And it's interesting because if you ask somebody to ask a question and they say, no, don't ask me a question, and then you follow that with a question about why don't you want to answer the question, that's also a question. But I think what you're really asking there is how do you proceed if somebody says no? And I think the way I proceed in that situation sometimes, and again, I want to acknowledge there are multiple factors here that people have acknowledged. The relationship you have with the person, the rapport you have with the person, whether you're meeting with the person for the first time or the 500th time. So all of those factors, and I will also throw in the wild card of what may be going on for that person in that particular moment, which we can never. I guess the thing that I don't lose your thought. I just guess the thing that I always try and be very aware of, I never assume the privilege of that I have the right to ask if I haven't asked permission. And that's just me. That's just how I proceed in a moment. Caroline, the floor is yours. And then I think somebody else unmuted and wanted to say something too. And yeah, and please don't lose your thought. We'll come right to you. Go right ahead, Caroline.
This conversation was making me think a little bit about people whose trauma response is full on. And what if, many times in their life, they just sort of went along with whatever, as a reaction. So somebody like that may give you permission, but still be uncomfortable and not really want to do it. So I think it's not only important maybe to listen to their verbal permission, but kind of gauge their body
Bingo.
language reaction.
Bingo. Bingo. And be attending to that as well. Because somebody might say, yes. And be, you know what I mean? Really kind of shrinking back. Yes, 100%. You want to be attending to all levels. I think, who is it that also wanted to add something?
I did.
Yeah, go right ahead. Opal, go right ahead, please.
So you keep saying to ask people if you can ask them a question, but shouldn't you preface that question with what you want to ask them about? Like, can I ask you something about your family? Or, I mean,
Sure, you
'cause
can.
it's so general to say, can I ask you a question? I tell you no in a heartbeat if you say, can I ask you a question? Because I don't know what you're going to ask me about.
Right. And you want to know.
Absolutely.
And then you'll make your determination based on what the topic may be.
Right, because if you wanted to ask me about my trauma, maybe I'm not ready to talk about that with you.
That's
But
right.
if you're asking me about, my siblings,
Yeah.
you know,
Yeah. So if I said to you something to the effect of, Opal, I'm wondering if I could ask you a question about what you know about diabetes.
I would say yes.
Okay, because then you would know what the topic was, and that would contribute to your safety.
Absolutely.
Fantastic. Thank you. Thanks for putting that on the table. All right. So I'm going to share my screen one more time. And I will throw out for your consideration the idea that, we're all considering the why, and we've been talking about why we would engage in this asking permission. And again, Opal, excellent addition to this idea of not just generally saying, can I ask you a question, giving some sort of landscape of what the question may be about so I can determine whether I want to ask or answer. I cannot underline enough that authentically, don't say to Opal or anybody else, could I ask you a question about diabetes? If you're not going to really authentically see if Opal wants to talk about that or not. So don't ask if you don't mean it. You want to be authentic. And I will also throw out, in order to use this strategy, you have to make a decision about your relationship to permission. And the purpose of it to create safety, to respect autonomy, to give that person a choice, and think about what Carrie said about the sharing of the power. Permission does that. It would be perfectly okay if Opal said to me, no, I don't want to talk about that. That's okay. I can accept that. I see that something else came in the chat. Let me check. Yes. Okay. Excellent. All right. So this is sort of the structural guide of what ask, offer, ask is. And let's just walk through this together as we start to kind of bring this learning community conversation to conclusion. The first ask is usually asking the person, and Opal, you really provided a great opportunity based on your comment. You provided a great opportunity of where we can preface, what do you know about diabetes? Whatever the topic may be, whatever the information may be that you want to share. Now, that would be different if you were offering feedback, but you could, to follow Opal's guideline, you might say, could I offer you some feedback on what you shared with me about your diet? And the person could say yes or no. So the first ask is, what do you know about it? Or what are your thoughts or your reactions about this particular thing? Okay. The offer, after the person shares that, so let's use the example that Opal and I kind of unintentionally put on the table, which is the diabetes thing. So let's say I were to have said, so what do you know about diabetes? Opal tells me everything that she knows about it. And what I would do is I would summarize or reflect back to her what she told me. And then if there was something I wanted to add to that, if there was additional information I wanted to add, or if there was feedback that I wanted to offer, I might say something to the effect of, I have some information in regard to this. Would it be okay if I share that information with you? And I would pause because remember, I'm asking permission. I would pause and see what Opal said. And if she said yes, I would then say, okay, well, the information I have to offer is this. And hopefully I would share that in a brief way, a concise way. And then I would follow that with, given what we've talked about, what do you make of that? Or what's your thought about that information and what we've been talking about so far? So the first ask is starting with them. What do they know? What's their perspective on this? Their second, the offer is, can I share this information? Can I share this feedback? And the third ask is, what do you make of that? And where would you go from there? Okay, so that's the essential structure of ask, offer, ask. And I'm going to stop sharing my screen for a minute, and I'm just going to ask any thoughts, any comments, any reactions to that before I add something to it.
I had something that came to my mind in just reading the words of offer.
Yeah.
I mean, maybe we've all felt like this sometimes. I don't know. I know that I've been in a position where an offer's been made and it's not really an offer. It's really like they're raring to go on sharing, and they really, so I'm just reflecting on what I need to bring to the offer question. A true openness, a true, like, it's really important.
Yeah, and Randy, there's a word I want to attach to what you're saying. And again, you can reject it if you don't like the word, but there's an intentionality to
Yeah.
it. And not only is it an intentionality, it's also a way of being.
Yeah.
Because it's an offer. It's not a ramming down somebody's.
Right. It's a true offer. It's really, truly an offer.
It's an offer. And not all offers are accepted.
No, they're not.
Yeah.
Thanks.
Yeah. Jasenia writes, can I share this feedback? It is so important because the client may just have been venting and did not that information. Yep. Okay. Yeah, go ahead, Susan. Go right ahead. Floor's yours.
Well, I just wanted to point out that you've been doing this whole time, where you say, take this or leave it, if you don't like it, it's okay, but you're offering something while also giving us permission to challenge it. And that feels like you're leveling the playing field and giving us as the participants in your training, the respect of that we also have something to bring. And I really appreciate that. I really like that approach. So thank you.
You're welcome. Thank you, Susan. You're really welcome. And it's also my pleasure to work that way. So thank you. Yeah, and Anita writes, the offer can feel like warning and not an option. And I will bring that back. Totally. Randy's nodding her head. Randy and I are both nodding our heads. Yes. And that has to do with it making sure that it's really an offer. It's not a warning. It's not you have to do this. And I'll give an example. and we're going to touch on this in just a moment, but if you're making a suggestion, because you can make a suggestion and you can frame a suggestion, some people that I've had the opportunity to work with around this, they engage in a couple of strategies to manage their diabetes. Would it be okay if I shared with you what they've done? That's very different than, Randy, as we've been talking about this, what you should do is this. Would you agree with that, Tracy? Would you agree? Okay, excellent. So again, and Randy, thank you so much for putting that on the table and putting it on the table the way you did, that we really want to consider how we make it a true offer as opposed to a directive. Yeah. Amber writes, this class has showed me a better way to communicate with my peers more clearly and also in my personal life, and about how important it is to use ask, offer, ask. Thank you, Paula. You're welcome, Amber. Excellent. So I'm going to share my screen again, and I'm going to try and leave a few extra moments for you to complete the evaluation, because I really want your feedback. We are going to make these slides available to you. I want to just remind you, as I reviewed this structure, there are two additional things, and you can also think of the idea that offer, we're doing what we can to make that a real offer as opposed to a directive. But remember, the first ask, when the person shares with us, and I'll go back to the example that Opal and I were talking about, the example of diabetes, when that person offers that information, we want to be attending to what they're saying. We're in a conversation with them, and we do want to reflect back or summarize what they said before we make our offer. And one additional thing I will add for the second ask that follows the second ask: after we engage in a conversation about what they made of what we talked about or what I offered and what they think about it, we can follow that with reaffirming their autonomy. We've talked about a number of these options, and I just want to acknowledge that, of course, you'll make whatever decision you want to make about how you'll use this information. So the second ask is followed by an affirming of their autonomy. Okay, so just keeping that in mind. And Esther writes, I love these templated statements. They're like I statements. Once you know them, they become easier to remember and use properly. Absolutely. And again, you'll make them your own based on the conversation that you're having, but this is the structure, and that's why I wanted to give you a structure. So ponder and consider. We're in a situation sometimes where we offer information, and when we did the percentages were high. People are often offering. Psychoeducation is part of the work. Sometimes we might want to offer a suggestion, and notice I said offer a suggestion. Or we might want to offer advice, or we might want to offer feedback. And the thing I really invite all of us to consider is we can do all those things by using this strategy and by truly making it an offer as opposed to a directive. So we can actually offer suggestions or advice as long as we give the person an opportunity, give them first the choice as to whether they want to hear it or not. And second, give them the opportunity to react and consider it if they want. And then to affirm that they will make whatever decision they want to make in regard to it. So just keeping that in mind, that you can do this as long as you're following through on this strategy. And it truly is, we're thinking of what Carrie said, you are sharing power and you are collaborating, and you know that ultimately they are the ones who are going to make the decision. So, autonomy. This all comes down to the person being able to exercise their autonomy. They will ultimately make the decision about what is best for them. And autonomy, and this was put on the table at the very beginning, but it bears repeating. Autonomy is the power to choose whether I want to answer that question about diabetes, whether I want to hear your offer or not, and what I will ultimately do going forward. So we can intentionally respect and protect. I love the way that sounds. Respect and protect this person's autonomy that we are having the opportunity to engage in this conversation with. We can position ourselves intentionally through this strategy as a way to build collaboration, which is basically keeping in mind that it is normal that we have the fixing reflex. We don't have to act it out. We can build that collaboration, as I was saying just a moment ago, and it can foster engagement that can actually grow into trust. And Ask, Offer, Ask is a way to collaboratively contribute our information, our suggestion, our advice, or our feedback, as long as we are being collaborative and not directive. We're not telling the person what they need to do. Folks, I'm about to show you the last slide in this conversation. Thank you so much for being here and for everything that you put on the table in regard to this conversation and the depth at which you're considering this particular strategy. It's really been a pleasure to be here with all of you. I hope that you will join future learning community conversations and have a wonderful, wonderful rest of your week. Thank you so much for being here, folks. Thank you very much.